I call Dr. Jackie Blue.
Speaker, I'm pleased to speak to the second reading of the New Zealand Public Health and Disability Amendment Bill. This bill proposes legislative changes which are a result of the Ministerial Review Group report earlier on, which I must admit, Mr. Speaker, is a landmark document, and the congratulation needs to go to Murray Horn and his team. They put a huge amount of work into that report. They travelled up and down the country looking at the sector and interviewing people who worked within the sector and made over 170 recommendations. It was a comprehensive review and I think a landmark document. They found a number of problems. There were common things. The problems were that we have an ageing population with more long-term health problems, Mr. Speaker, and greater health care in the future will be required. There was issues of health workforce, high dependency on overseas born and trained staff in a world of growing health workforce shortages. Mr. Speaker, we can't compete internationally with salaries. We have to compete with how we treat our staff, what we can offer them and their working conditions. The hospital services they found in some areas were quite vulnerable to staff shortages and particularly in some of the smaller DHBs. There were mixed health indicators when compared to other OECD countries, and waiting times and volumes of elective surgery were a concern to the public at large. There were concerns about preventable errors and quality of care. They were concerned about the financial viability of the public health system, that despite the billions of dollars that have been poured into it, DHBs were still running at a deficit. They made a number of recommendations. They wanted to look away at new models of patient care, importantly stronger clinical management, and that has become a cornerstone policy, I'm pleased to say, and I think that work that's been done through the report has and also been supported strongly by the Minister is now translating into efficiencies and a better working environment for clinicians in the public health sector. They wanted a sharper focus on patient safety and quality of care to ensure better results for patients. And of course identifying services that were really needed and looking at duplication. Importantly, a change of culture was needed. And change of culture is something you can't legislate for, but importantly I think clinical leadership, as I say, has been the cornerstone policy which has translated into new ways of working. And I make a point here with the health targets the Health Minister has brought in, the 6 health targets. Already, I think clinical leadership, there was a comment by a previous speaker that we are measuring outcomes. Well, yes, it's good to have targets because it focuses the mind, but also to achieve those targets, it just doesn't happen overnight. It involves clinicians working together to make efficiencies to achieve those targets. The targets of elective surgery have been phenomenally successful in the last couple of years. Cancer treatment times, in the last term of Parliament there wasn't a month or week that went by if there wasn't some blowout of a radiotherapy oncology waiting time. Patients were waiting, being shipped off to Australia, and it was totally unsatisfactory. Emergency waiting times. Emergency departments are considered to be the barometer, the window, the shop window of a public hospital. And when the emergency department waiting times blow out, you know there's something going wrong in the system somewhere. And so the target of 95% being processed within 6 hours really has made a big difference. Many DHBs are achieving that, and we can see that in the quarterly league tables that are published in the national papers. And there's been some comments about publishing those types of tables, that's not a good thing to do. But in actual fact, is actually, we heard a comment from Dave Galler, who advises the Minister of Health, and he's a clinician in his own right. And he said that clinicians actually welcomed these tables. They wanted the benchmarks, and it means that they could compare themselves to other DHBs, and you will see that initially we perhaps had patchy performance, some DHBs doing well in some targets, others are not. But over time, the game is being lifted, and that's because we have that data that's been presented in a uniform way. Mr. Speaker, importantly, this bill is not about a major restructure. This is about making things work more efficiently. We've had a system of 21 DHBs doing 21 different ways of working, and it's basically reinventing the wheel 21 different ways. One provision of the bill, Mr. Speaker, is to provide shared administrative support and procurement services across the public health system, including additional powers such as ministerial direction to enhance ministerial ability to require greater system collaboration and the use of shared services. And the Minister of Health has already made some changes in the way to improve the health sector. The Clinical Training Agency was established to help unify workforce planning. Mr. Speaker, we have a crisis in the workforce. In the last term of government, we had 50 or 40 health work reports, one after the other, all saying there was a problem, but not much happening about the problem. This Clinical Training Agency, headed by Professor Des Gorman, is making changes, and already that's impacting on the health workforce already in this country. Mr. Speaker, this bill is about getting our DHBs working more efficiently, and it's about reducing the number of committees, about reducing bureaucracy, it is about getting better value for money. I make no apology for that. It will ensure greater national and regional cooperation in the sector, and that can only be good for the patients who are at the centre of this health system. Thank you, Mr. Speaker.